Hello friends, today we're going to discuss about Telepsychiatry Operational Guidelines, Teletriage. I'm Dr. Suresh, Professor of Psychiatry, working at NIMHANS, Bangalore. Telepsychiatry Operational Guidelines 2020 was drafted by NIMHANS, Bangalore in association with Indian Psychiatric Society and Telemedicine Society of India. This telemedicine operational guideline has 8 different chapters. The first chapter is the legality of telepsychiatry, advertisement and social media, technology of telepsychiatry, electronic records, stepwise operation of telemedicine guidelines, that is before telepsychiatric consultation, during consultation, after consultation. The 6th and 7th chapter and 8th chapter are considered as advance in telepsychiatry consultation. Chapter 6 talks about first consultation, follow-up consultation, telepsychiatric consultation initiated by the family members in the presence of patient or in the absence of patient. Along with this, we will be discussing about prescription, list A, O, B, and also prohibited list. The last chapter will be telepsychotherapy, and this is a very important chapter where the psychiatrist will be providing counseling or telepsychotherapy. Now let's move into telepsychiatry triage. Triage is nothing but here the patient care will be given based on the priority. Here now there is a proxy consultation has been requested by the family member. It's basically a family member has initiated the telepsychiatry consultation. Here the family member can be nominated representative or else any other person authorized by the patient for telepsychiatry consultation. For this to happen, there should be very clearly an authorized letter with the informed consent as per the Appendix 4 in the telepsychiatry operational guidelines has to be filled by the patient and handed over to the person who is going to do telepsychiatry consultation. That will be given to the psychiatrist. This is how authorization letter looks like. This has to be filled by the patient and will be signed by both the patient and the person, the NR, nominated representative, will be signing it, and that will be given to the psychiatrist. If the caregiver is initiating the telepsychiatry consultation, here the caregiver is a family member or any other person authorized by the patient to represent him. But however, here there are two situations. One is the caregiver has requested for a consultation along with the patient. Second one is the caregiver has requested for a telepsychiatric consultation in the absence of the patient. Again, that is followed if the patient is minor, less than 16 years, means the patient is a minor, the NR or the legal guardian will take the decision on behalf of the child. There, the telepsychiatric consultation can be done easily in the absence of the patient. However, if the psychiatrist wants to see the patient, definitely he can ask for in-person consultation, or else he would like to talk online, should be facilitated. Otherwise, the psychiatrist will refer them for in-person consultation. But however, the second important point is if the patient is incapacitated, he has lost his mental capacity. This is a situation whether the caregiver can continue with the telepsychiatric consultation we'll be discussing. Let's discuss initiation of a telepsychiatric consultation by a family member when patient is present with them. This is how the telepsychiatric consultation is done when a family member and the patient both are there. When both of them are there, the psychiatrist will check for the ID of the patient, age proof, and also he will ask for any valid document establishing the relationship between the patient and the family member. If the patient is a child, is less than 16 years, and the clear-cut establishment of relationship is there, he is a guardian, legal guardian, or the parents, then the consultation will continue as per the will or the wish of the family member. If the patient is an adult, and if the patient is an adult, on capacity assessment, if the patient has capacity, then the consultation will proceed as per the will of the patient. During this process, the psychiatrist will assess whether the patient is comfortable discussing his issues in the presence of a third party. If he sees yes, the consultation will continue. If he places a reservation, the psychiatrist will request the other person, maybe caregiver or family member, to move out of the consultation chamber. By chance, if the patient doesn't have capacity, in such a scenario, if it is a first consult, then there will be a counseling will be done and they will be requested to come for in-person consultation. By chance, if it doesn't have capacity, but at the same time it is a follow-up consult, in such a scenario, the psychiatrist will check for any advance directive and he will follow the advance directive as per the wishes of the patient. And if he is very doubtful and he feels the patient is violent, the in-person consultation will be requested immediately. Initiation of a telepsychiatry consultation by a family member in the absence of a patient. All in-person consultation will be advised in the absence of a patient and it is a first consultation. Please do remember this. Very important point. For all in absentia, first consult should be in-person consultation. Let's go through the flow chart. If a caregiver has placed for a consultation in the absence of the patient, if it is a first consult, in-person consultation should be advised. If it is a tele follow-up consultation, check for the authorization ID and the psychiatrist is able to establish the relationship between the patient and the family member. And if there is an authorization letter, tele follow-up consultation will continue. If there are no proper documentation and the psychiatrist is not comfortable to give any consultation in the absence of the patient, can refuse and ask for in-person consultation. Now, let's spend time on discussing about proxy consultation and proxy prescription. Invariably, in all psychiatric settings, 30 to 40% of them will be proxy consultation and proxy prescription. But however, especially in telepsychiatry consultation, do not give prescription to a caregiver in the absence of the patient unless there is an authorization letter and there is a proof of ID of both the patient and the family member. And he is able to establish the relationship between patient and the family member and there is adequate documentation. Then only the proxy consultation will be honored. By chance, if the psychiatrist is not comfortable by the reason of professional discretion, he will request them for in-person consultation. Family members are requesting for a parental injection because patient is refusing for medication. What should a psychiatrist do? In such a scenario, the psychiatrist should request for in-person consultation. Whenever patient is refusing medication and the family members are requesting for parental injection and you do not know the mental capacity status of the patient, in such a scenario, it is advisable for in-person consultation. Avoid all those patients who have poor compliance on telepsychiatry consultation. Further, for injection, the Board of Governors of Telemedicine Practice Guideline are very clear. They said that parental injection can be given only whenever the consultation is between a psychiatrist and another healthcare worker or with the RMP. It will be a collaborative video consultation. That means the healthcare worker will go to the patient's house. From there, he would have been doing the consultation. In such a scenario, when the healthcare worker is on the other side, the psychiatrist can issue the injectables. Otherwise, the psychiatrist is not authorized to give injection directly to the patient as a prescription because it requires a healthcare worker to deliver those injections. At the same time, please do remember, whenever such prescription is given to the healthcare worker and the healthcare worker is going to give the injection, the psychiatrist should remember about the vicarious liability. He should be confident about the skills of the nurse or the healthcare worker. And at the same time, he should clearly know that all the facilities are available when the parental injection is given. Now, one more important which is very often requested by the family members of persons with mental illness. The patient is refusing to come to meet the psychiatrist or else refusing medication. In such a scenario, whether a healthcare worker can go to the patient's house and can he do a telepsychiatry consultation along with the psychiatrist? Of course, the healthcare workers are all those who are nurse, allied health professionals, mid-level healthcare practitioners, A&M, or any other health practitioners who are designated by the appropriate authority. And this healthcare worker can start a collaborative video consultation along with the psychiatrist, either from the home or maybe in a community or else from a satellite clinic or from a mobile medical unit. They can initiate this consultation from any part of the community. But however, it can be consulted to a private psychiatrist or to a public psychiatrist. And here, very important is the healthcare worker should obtain explicit consent from the patient. At the same time, if there is no informed consent, please refer them for in-person consultation. At the same time, healthcare worker and RMP, when the collaborative telepsychiatry consultation is done, both of them will ask for ID, identify them, and then the consultation will be given. This is how the process occurs. Healthcare worker in a community setting, he goes to the patient's house, will check for the ID of the patient, check for the information, will gather the information. At the same time, we will do capacity assessment. If the capacity is present and the patient gives a consent, we'll go ahead with the telepsychiatry consultation along with the patient. If the patient refuses telepsychiatry consultation, we'll stop the consultation because the patient has capacity. By chance, if the patient doesn't have capacity, and if it is a first consultation, it will be referred for in-person consultation. He will check for if there is an advance directive. If the advance directive is there, he will follow the advance directive. If there is no advance directive, the psychiatrist will take the consent from the NR and he will proceed as per the Mental Health Care Act for providing care for persons with mental illness. Telepsychotherapy. The psychiatrists have been trained in providing psychotherapy. However, because of pandemic, online telepsychotherapy is becoming very popular. And here, the psychiatrist can do telepsychotherapy at the same time can also prescribe medication. Or else, he can keep it separately. That is, he can do a consultation for medication and he may do a psychotherapy later. That is after 1 week down the line. But however, before you resort to these kinds of telepsychotherapy, please do check for whether the patient is fit for telepsychotherapy. Check whether there is impulsivity, whether there is emergency care is required. In such a scenario, in-person consultation will be advised. In every session, the psychiatrist should check for any emergency care is required. And in every session, the psychiatrist will ask for ID of the patient. Only after positive identification, we will do telepsychotherapy. Here, the telepsychotherapy has been advocated by telemedicine practice guideline by mentioning as counseling for specific clinical condition. So, cognitive behavioral therapy, wellness therapy, all those come under this category. At the same time, if you are going to have a caregiver during telepsychotherapy, please do take explicit consent from the patient. And again, all consultation should be pre-planned. Please avoid or refuse to provide emergency consultation. Please do inform them all emergency consultation will be given in-person consultation referral. In a scenario of an emergency situation, the psychiatrist will not be able to help them through telepsychotherapy or teleconsultation. Hence, in-person consultation is mandatory and a copy of the telemedicine practice guideline can be given to the patient and the patient's family member. Please do remember about the basic medical record. Whenever the patient undergoes telepsychotherapy, the psychiatrist is mandated to keep a basic medical record. And whenever the patient requests for basic medical record on a case-to-case basis, and for every session, psychiatrist should do the documentation and session notes should be available for the patient. And this is how the proforma of the counseling reporting form is here. This need to be filled for every session and should be made available whenever the patient asks for basic medical record. And the consent form for the telepsychotherapy looks very comprehensive and should be used. Now coming to the prescribing medication online. What are the different categories? How they are given? The prescribing list, there are four important: list O, A, B, and list C. List C is nothing but prohibited medication which cannot be given online. Coming to the list O. List O is over-the-counter medication like paracetamol, antacids, syrups, and vitamin. So these, for any type of consultation, list O can be given. List A is given for only video consultation for first consult and for any type of consultation for follow-up consult. That is mode I am talking about. Coming to the list B is a list of medication which RMP can prescribe in a patient who is undergoing follow-up consultation. That is, in the past 6 months, he has met the psychiatrist in person. In such a scenario, list B can be given for online consultation. Let's look into the matrix of permissible drug list. The first row is basically for the headings. The second row is list O. List O, any type of mode of consultation is allowed: audio, video, or text. The nature of consultation, it can be first consult or follow-up consult. Those are all list O, over-the-counter medication. List A. For list A, for the first consultation, video consultation is a must. But however, for follow-up, it can be audio, video, or text methodology. Coming to the list B. List B, any type of consultation, mode of consultation is allowed. However, the past 6 months, it has to be in person and only follow-up, the list B can be given. But however, remember, last one is prohibited. Under no circumstances, the psychiatrist will issue online prescription for these medications. Let's go into the list A. The list A has been clearly mentioned in the Telepsychiatry operational guideline based upon the best logical explanation. The list A is nothing but essential drug list which are notified under the Mental Health Care Act of 2017. This notification was issued on 16th August 2019. All essential drug list under the Mental Health Care Act will become list A. These are the list. This is available in the web notification. Again, please do remember, injections, online prescription shall be given by a psychiatrist to an RMP or a nurse. Don't give prescription online directly to the patient, especially the injections. At the same time, please do not give prescription for zolpidem, lorazepam, or else injection risperidone or olanzapine. All these requires a healthcare worker, and especially injection risperidone requires presence of a psychiatrist. But however, with regard to clonazepam and clobazam, there has been an amendment by the MCI, and they have allowed clobazam and clonazepam, although they fall under the Narcotic Drugs and Psychotropic Substance Act of 1985. These are list A. The only reason for list A has been these medicines because they fall under essential category. However, the author of this Telepsychiatry operational guidelines and his colleagues tried to classify many of the drugs into list A. Unfortunately, there has been any logical or reasoning was made available. It was difficult to think which will become list A and which will become list B. For example, for schizophrenia, the first line of treatment for a child is different, for an adolescent is different, a young lady is different, for a pregnant lady is different, for an elderly person is different. That means diagnosis is same. But however, depending upon the age, depending upon the pregnancy, depending upon various other factors, the first line of medication changes. The only prudent mechanism and the explanation of logically was understood by keeping all list A medicines coming under the essential drug list. Coming to the list B. List B are all other medications which do not fall under list A and list C, that is prohibited medication. However, the authors of the telepsychiatry operation guidelines have clearly mentioned other medicines for antipsychotics, other medicines for antidepressants, similarly for anti-craving, anti-dementia drugs, anti-ADHD drug, mood stabilizers, beta blockers, and injectables. Here, others means basically any new medication coming not require any amendment. They automatically come under this category of other medications. At the same time, please do remember there have been parental injection which comes under the list B, such as zuclofenthiazole, flufenthiazole, haloperidol, and aripiprazole. These medications will be given to another healthcare worker via collaborative video consultation. Don't give parental injections prescription directly to the patient when an online consultation is done. Coming to the prohibited list, there are two important things you should remember in the prohibited list. Those medicines which fall under Drugs and Cosmetic Act of 1940 and Rules 1945, such as amphetamine, methamphetamine, dexamphetamine, encyclidine, methylphenidate, and many other medicines. Please do not prescribe online. They are completely prohibited. One more important category is NDPS drugs which are notified. Those medicines such as buprenorphine, methadone, codeine, tramadol, cannabis, benzodiazepines should not be again prescribed online. Both these groups have been clearly prohibited for online consultation prescription. But however, as I mentioned, there has been a clear MCI amendment with regard to phenobarbital, clobazam, and clonazepam. On 11th of 4, 2020, this notification was issued with regard to allowing phenobarbital, clobazam, and clonazepam can be prescribed for either the first consultation or follow-up consultation. And this has been done because many of the seizure patients require the NDPS medicines like phenobarbital, clobazam, and clonazepam that has been allowed under the MCI amendment on 11/4/2020. Let's look into the format of prescription. This is how the format of the prescription as per the telemedicine practice guideline is made available. Please do remember when the prescription is written, you have to write about the chief complaints, relevant history, examination, lab findings, and also suggested investigation. Don't forget to mention about provisional diagnosis. And if you're able to arrive for a complete comprehensive diagnosis, it's well and good. Please document about the medications and also special instruction which has been mentioned. And in the bottom, you have to mention about whether this prescription was issued online or in person has to be documented. To conclude, my dear friends, before you start for a telepsychiatry consultation, identification of both parties are very essential. Psychiatrist will introduce himself. At the same time, he will verify whether the patient's ID matches with the patient. Proxy consultation, be careful. All proxy consultation for the first consultation request for in-person consultation. Authorization is a letter must for tele follow-up in the absence of the patient. Legal issues are similar to in-person consultation. Just because you are providing telepsychiatry consultation, you cannot forego other laws. All in-laws which are applicable for in-person consultation is applicable for telepsychiatry consultation. Please do use telemedicine technology to provide psychotherapy. And don't forget to follow Mental Health Care Act. Thank you very much for giving your valuable time. Stay safe.